A new documentary detailing the chilling trials and tribulations of the COVID-19 aftermath comes out next month called COVID Collateral. It highlights the societal destruction caused by the very measures purported to protect public health, and how big tech and big government collusion gave way to an illusion of consensus on everything from lockdowns to early treatment options to mandates. COVID Collateral explores the suppression of dissenting voices by those at the highest level of medical establishments, big tech, and governments, unraveling the consequences of censorship in a free society. The director, Vanessa Dillon, a documentary filmmaker with over 2 decades of diverse subject matter expertise, joins me now to discuss this documentary. But first, check out the trailer.
As the virus continues to spread, so does fear.
Stay home.
Shelter in place.
Locking down is not only the only tool, it's the best tool.
The public did not know that there were prominent scientists that disagreed with the lockdown policies.
Across the country, 2,200 cases.
That number is going to skyrocket.
This is moving very fast.
The federal government was regularly censoring dissenting opinions.
They wanted to create an illusion of consensus.
This hurt a lot of people.
We're being told not to contradict any kind of public health orders at the risk of losing our license.
Suddenly, just boom, you're fired and no explanation.
I'm giving you 90 days notice of termination between the health authority and yourself.
This goes all the way back to January 2020.
About 3.4% of reported COVID-19 cases have died.
I knew immediately that was a vast exaggeration.
It was starting to look more and more like we had misunderstood what the infection fatality rate was going to look like.
If you're going to make a case for lockdown, you absolutely need to know how widespread the disease is and how deadly it is.
I was asked to be an advisor to the president during the biggest healthcare crisis in a century. Fauci, the task force, were instilling panic in the public instead of articulating the data.
The entire world, country after country, copied what China had done. It's absolutely insane.
And this was shocking to me in a free society to simply decree the lockdowns.
We wanted to tell the world that there was an alternate view that prominent scientists had.
A group of more than 40 epidemiologists and public health scientists reject closing economies.
The National Institute of Health called for a devastating published takedown, engaged the press in mere jobs and hit pieces. This whole lockdown philosophy makes us fundamentally change our civilizations. And it will come back over and over again unless we as a society decide that we do not want to live this way.
I pitched the concept of this film of the suppression of science during the period of COVID. I did all my due diligence, wrote it up, put in place a great team, but there was a wall of silence across Canada, and broadcasters who knew my work were either politely silent or just said, no, this isn't for us. So there was this real trepidation. Also, in my own industry, it was difficult to get people to actually work on this. Outside of my creative core team, it was difficult to get business people. Even the closed captioning technician recently said, no thanks. So there was a lot of, let's say, quiet hostility towards this film.
But that didn't stop Dillon from moving forward, armed with a burning desire to feature leading figures in the fields of epidemiology, public health, and the natural sciences who were ridiculed, silenced, and censored by medical institutions and the media alike.
Really well-known epidemiologists, public health doctors who said, we don't have the science to base lockdowns on. So they were against lockdowns, and they were ridiculed. These were leading figures in their field. So I was wondering what was going on. They were ridiculed by medical institutions and also by the media. They were called fringe. These were people like Jay Bhattacharya from Stanford, Scott Atlas, who is a major public health figure in the U.S., Sunetra Gupta from Oxford. So I wondered, what is going on? Why is there such censorship of these people? And I realized that we already had a pandemic plan in place, because medical institutions knew that we were overdue for a pandemic. The last one was in 1918. And that was far more deadly than COVID, because you had entire families wiped out by the Spanish flu. So I wonder what's going on here. Plus, I noticed that the restrictions that were being put on the average citizen during lockdown made absolutely no sense.
Like most logical, reasonable people, Dylan couldn't rationalize why people were deemed safe to go to Walmart to purchase power tools, for instance, but at the same time, the ma and pop small business hardware stores were ordered shut.
The other thing that prompted me to make this film is that I realized that we were not bearing the burden of this pandemic equally. That there was a laptop class there that if they stayed home on their laptops and they got paid, these are government workers or related government workers. They may have children, but they were going to get paid. And yet there was an entire class of low-income workers who, and this is pre-vaccine, who actually had to show up somewhere to get paid. So there were a lot of workers who bore this pandemic disproportionately, and it landed on the lower income workers. That, so collectively, these are the reasons that that motivated me to make this film.
Now, the entire basis of the film is to explore how censoring science affects a free society. That is, how the suppression of scientific debate leads to distorted public understanding, hinders policymaking, and erodes trust in our institutions.
Well, as one of our chief doctors in the film says, if you censor science, as opposed to censoring other things, people die. That is, if public institutions don't give the public accurate facts, if there are too many competing interests against these facts, then people are not well served. We show the example of ventilators in New York that were overused. Surely public health officers knew what being on a ventilator meant, and that ventilators are only supposed to be a stopgap measure. But there were so many deaths from the actual use of ventilators that public health finally stopped them. One of the other things that the film points out about the censorship of science is that the drug ivermectin and other drugs such as hydroxychloroquine, but especially ivermectin, has been used for many, many, many years off-label for many illnesses. And we do know that worldwide ivermectin was used very successfully in early stages of COVID. But many doctors who would have wanted to use ivermectin were, with their patients, were actually banned from doing so from the FDA. And the FDA created an entire public relations campaign saying, you're not a horse, you're not a cow, y'all, you got to stop this. And so that's an example of perhaps people, had they been given drugs like ivermectin, or had they been able to have an honest conversation with their doctor without the politics interfering in the relationship between patient and doctor, perhaps those people either could have been saved or may have had an easier time.
World Health Organization moves to strengthen its mandate and insert itself into the health happenings of its member states at its whim through amendments to existing legally binding international health regulations and a new pandemic treaty. Dillon says we must remain sovereign in the aftermath of COVID-19.
In terms of the WHO putting a new pandemic treaty in place, and that is, we must, as independent nations, make sure that we control our destinies. We must make sure that our public institutions, especially our health institutions, have the public's interest at heart, not the globalists' interest at heart, but actually Canadian interests at heart. And I think we need to look very, very carefully at what the WHO is planning. I think it means that we as Canadian citizens or citizens of any country need to hold their governments to account and their health officials to make sure that they actually have the public interest at heart.
If you're interested in the screening of this enlightening documentary, then you can access tickets at covidcollateral.com. An advanced screening will take place on Thursday, May the 9th at the Elizabeth Bader Theatre in Toronto. It will be moderated by former award-winning CBC investigative journalist Rodney Palmer and will feature speakers like law professor Bruce Pardy, Jennifer Hibbard from Canada Health Alliance, and former emergency department physician Roshan Killian. For Rebel News, I'm Tamara Ugolini. The emergency use authorized novel COVID-19 injections wouldn't have been needed if early treatment options were not discredited and censored. If you'd like to learn more about the novel injections and call on Health Minister Mark Holland to revoke market authorization for them, please do so at nomoreshots.ca. There you can also consider pitching in to support this kind of work at nomoreshots.ca.